This is the Owens Recovery Science Podcast.
All right, welcome back to another Owens Recovery Science Podcast. I'm Johnny Owens here with the one and only Kyle Kimbrell as usual. Kyle, what's up, man?
I thought you were going to introduce me as the man, the myth, the legend this time, Johnny.
No.
I thought we had agreed upon that.
I barely introduced you as the man. You can work on the other titles later on.
We're T-minus 5 seconds into the podcast. Johnny's already gotten one shot at me.
Oh man, I'm ready. I got a lot ready for you today. Cool. So this is going to be a really badass podcast because it's about something I'm very excited about, and it's got some BFR angle to it. And, we always are going to bring that angle to it, but it's about this new technology that's amazing. And so, Kyle, I always get this question, like, what's other technology that you guys are seeing, either from the military standpoint or, we're working with all the teams or we're all around these fancy facilities. What new technology are you seeing out there? Shameless plug, I have a paper of how new technologies help in physical therapy. It was out last year in current reviews of musculoskeletal medicine. So you could just read that. But there's also something that we're partnered with now. I'm an external advisor. We got a really nice 7-figure DoD grant to study BFR and ACLs, and this technology is something we're going to be using as one of our main objective measures. And then so, MRIs, Kyle, you've had an MRI before?
Actually, no, never have.
Haven't? Oh yeah,
I've been fortunate.
You're not an athlete, I forgot. So,
so
MRIs.
I was not a pitcher.
MRIs, they always kind of feel like you could get more from them. You sit there forever. It clanks all this noise, and then you get done and you get this black and white kind of 2D analysis. So you know what I always say, Kyle?
How does it work above the cuff?
Don't you hate when people say that? My dad would always do that. So, what I always say, and I'm like, I don't freaking know. You're the one talking.
No idea what you always say. I'm going to ask your teenage daughter.
You can't beat a clean rug. Like, what the hell does that even mean? And why did you just say it? Why are you making a big guess?
I can tell you what my dad always says. He used to say, well, Kyle,
why the hell did I have a daughter?
No, yeah, exactly. Damn it. He said,
what does he say?
It's better to be pissed off than pissed on.
Okay. On that note,
that's very true.
It's true. Some people might disagree. They're weird. So anyways, let's get back to this. So MRIs, you get this black and white 2D analysis. Yeah. In the military, we could order MRIs as therapists and we would get them and interpret them, or we could just interpret them. I could tell you if you tore your ACL, that's about it. But then what about the muscle? We never really got a lot about the muscle. When we do research and we use MRIs, trying to get a musculoskeletal radiologist that will measure muscle cross-sectional area for us is pretty much next to impossible lots of times. And so that's where this technology comes in. It's called Springbok. Springbok. It's badass. They've been working on this for years, and I'm going to let the head guys here talk about that. But it's out now. It's available for everyone to use. We're already seeing it used quite a bit in the professional world. We used it with Alex Smith, if anyone saw that piece. And so, without further ado, from Springbok, I'd like to introduce Joe Hart, who's one of the co-founders, and Scott McGargy, who is the CEO of Springbok. What's up, fellas?
Hey, thanks for having us here today.
Yeah, sorry about the intro there. I had to get on Kyle a little bit. So you guys are up in Virginia. Joe, will you give me a little bit tell us your bio?
Yeah, absolutely. So I'm one of the co-founders and currently serve as an advisor to Springbok Analytics. My background is actually as an athletic trainer in training, and I'm a PhD now and a professor of kinesiology at the University of Virginia and the director of clinical research for UVA Orthopedics. I study lower body injuries, specifically knee injuries and ACL, and how patients recover and get back to being physically active and back to their sports.
Nice, man. That's also, I didn't know you're an AT as well. That's cool.
Very cool.
Yeah, very cool. Scott, how about you? Background.
Yeah, I appreciate it, Johnny and Kyle. First of all, I've learned a ton of new phrases, so I appreciate that. It's already been educational for me. So getting more out of this that I'm going to give to the audience here. But I am the CEO of Springbok joined it a couple years ago. My background is really in commercializing some early stage digital health technologies, and got really excited about Springbok, having seen kind of the space from what Joe and Sylvia and Craig built with this technology, and so kind of our mission is to get this out into the masses of and many demographics with respect to kind of improving the personalized care and precision medicine approach.
So what is Springbok? Let's just jump right into it.
Yeah, sure. Go ahead, Joe. You want to give us the history of that?
Absolutely. So the technology started as a research project to help kind of model the muscles and tendons of children with cerebral palsy, to help surgeons. The original objective was to help surgeons plan for tendon lengthening procedures. It soon evolved to other injury models, knee osteoarthritis, for example, patients who are undergoing surgical procedures for chondroplasties or other types of debridement lavage procedures that were really kind of, in some ways exploratory in nature. So we kind of decided to do this technology to really encourage surgeons and and patients and their healthcare teams to really pay a lot more attention to muscle as a recovery mode, or as a target for recovery. So the scans that we did back then are very similar in nature to the scans that we're doing now. The problem was, in order to go from a 2D black and white image to a 3D color model, it took maybe 55 to 60 hours of manual segmentation, and a lot of frustrated medical students and graduate students that are still not talking to us now. We're kind of behind this initial work, and that really wasn't useful for the patient or their healthcare teams to say, hey, let's scan today and I'll give you a result a month from now. So the technology that we've developed is a way that that leverages artificial intelligence to basically do that work in seconds. So we can scan you now, and in less than an hour from now, you can have a full report. I mean, every bit of that data that comes from the MR scan is being used to help inform decisions and to help drive the care. And it's funny that soon after, when I got involved early and we were doing this work in orthopedics, we kind of pivoted quickly to a sports medicine story to look at athletes. It's a huge market, and athletes are so susceptible to injury because they're in kind of a at-risk environment, day in and day out. So we initially pivoted to tell a injury prevention story, and then a performance enhancement story, as well as recovery from injury. So we started scanning the track team at UVA, which is really where we started. And that's where it got super interesting for us, because now we started to develop an understanding about how muscle volumes were distributed in the lower extremity that made an athlete, that made a human, an otherwise healthy 18 to 22-year-old, a superhuman runner. So we started studying these like really successful, fast people, and kind of developed an understanding of like an athlete phenotype, like where muscles needed to be bigger and where muscles needed to be smaller, that differentiated a typical person to an athletic person. So that's kind of where our technology started. And from then we've kind of have all these different applications to, basketball and football and professional sports, to the weekend warriors, and obviously injury and rehabilitation models also. So yeah, that's kind of a quick run through our story and kind of where we started.
And so essentially just a standard MRI scan, so if we're going to describe to a patient what they need to do, they go get an MR, and you can take what was done in that MR, and if they upload it to your system, we're going to get this elaborate scan back.
That's right. A very detailed muscle by muscle. Every muscle that is scanned is individually segmented, and data is provided about the volume, size, and shape of that particular muscle in relation to the opposite side, and in relation to our kind of normative and reference data sets. So you can kind of see where a person who's scanned can see where they sit, where they sit compared to themselves, side to side symmetry, and also where they sit on a spectrum of how big a muscle would be based on how tall and heavy that person is.
Yeah, it's super cool. Everyone that we've sent to you guys or feedback we've got, when you see the scan, you're just like, wow, that's freaking cool, because it's a 3D body. You know, it's the actual person's limbs. You know, if you know the patient, you know, like Alex is like, yep, I know that leg. You know, you know that person, and then it's so easy to read. You know, it's color coded, so you have can you kind of go into that, what the different colors of the muscle mean?
Yeah, no, absolutely. So we provide this kind of color key for each of our Springbok scans that ranges from kind of a very rich red color, which means smaller than normal or smaller than the opposite side, to a very rich blue color, which means larger than normal or larger than the opposite side. It gives you a range of a muscle that's atrophied due to injury on the red side of the scale, to something that's, you know, hypertrophied or larger than normal or overdeveloped, which is on the blue side of the scale. And there's shades of blue and red on each side of the scale that gives a fairly precise indicator of where each muscle sits on that spectrum of symmetry or in relation to other reference data sets. And those data sets can be referenced based on a kind of a healthy normative set or like a specialized set. So you can see where your muscles sit compared to all the fastest runners in our data set or highest jumpers in our data set.
Yeah, and also I guess from an injury side, you know, I got a scan from you guys. It was on an NBA player, and it was a hamstring injury, and there was still this fibrotic area in there. And so, are there other things that you're picking up? You know, we're gonna be working on picking up bone, fatty infiltrate, things like that, fibrosis.
Yeah, all of that. Scott, did you want to talk about that a little bit?
Yeah, sure. So we're actually, it's great to watch our engineers to kind of really wring the sponge and get all the value we can out of these MRIs. And so we've got this muscle volume score down very well, and we're going to now taking some fat mass muscle measurements of the lower extremities to pair that with the muscle volume scores. We're also doing fatty infiltrate in the rotator cuff shoulder space, and then and now taking the lumbar spine and the multifidus in particular, and taking a look at some fat infiltrate there. And so that's kind of a very easy, quick add-on to our service, where we're going to do something on a longer term basis is with respect to essentially measuring the tendon volume and being able to take a look at that along with the muscle and the fat measurements. So that'll be a really significant piece of the puzzle that we'll be able to add here in the coming quarters.
And so I definitely know the difference and how, you know, kind of sensitive we can get with this. But if someone says, well, what makes this different than something like a DEXA? Have you guys got that question before?
Yeah, we get it a lot.
No, totally. And I think that the MR scan is really the gold standard of looking at every tissue in the body. And from a muscle perspective, it's really again, I'm not an MR imaging expert, but it's very clear to me that the MR is the best at looking at each individual muscle, which kind of enables our platform to give the most precise information possible. And really anything that MR sequences can be modified to look at different tissues. So really anything that can be visualized in a 2D image, we can train our algorithms to kind of segment into a 3D model. That's kind of what Scott was talking about. You know, tendon, fatty infiltration, scar tissue, fibrosis, and healthy muscle tissue are all kind of on our radar.
It's crazy too. You know, I thought I had the most brilliant eyes and hands in the world. They're not as good as this damn AI stuff out there. Because, you know, we had one of our Paralympians
Johnny,
and we were looking at her.
expert.
Yeah. We were, you know, a Paralympian scan, and you know, we start peeling away the muscle and looking at these asymmetries she had. there were muscle groups in there that we just thought were not an issue at all, and could be explaining maybe some of the issues that she was having. And it's something you're never going to pick up, and some of these muscles are very hard to even do a manual muscle test on or something like that. So that was a very kind of cool and eye-opening thing to see as well.
Well, and I think that from my perspective, or from our perspective, it's really fascinating to deliver one of these reports, and in particular the athlete you were talking about, Johnny, and watching the care team, yourself, Dr. Alderetti, others, be able to know the history of that particular athlete and see kind of objectively what's going on with the musculature based upon the Springbok analysis, and talk through kind of what adjustments might be able to be made, or what things you're seeing that maybe couldn't get with your magic hands or observational techniques. And so I think that it really is it's really fascinating, but also kind of really exciting to watch you as experts when we put this information in your hands, to be able to see how it's going to modify the way you take care of athletes, patients, whomever.
The only problem is the damn DOD and the bureaucracy took so long to get us that scan back that she was already over in the Olympics by the time we're reading it. So
yeah.
Anyways,
well, if she's listening, I would love to get her another scan shortly. So.
Yeah, I bet we will. Cool. Yeah, and what also is your money's where your mouth is. This is being used, and this is very similar to us. We want to do research and see how this can help with research. And so you bastards, y'all beat us out for the NFL hamstring grant. I mean, we had every SEC team but one.
I didn't realize that was y'all. Y'all were on that. Oh.
Yeah, dude. So yeah, we got a full proposal, and they're like,
full
no,
circle.
we gave all the money to this one group. We're like, all the money? You couldn't share a little bit with us? So anyways, congratulations. And that's why we brought y'all in for our DOD study, because if you can't beat them now, you're going to join them. But y'all want to talk about that a little bit, as much as you can, of what you got with the NFL hamstring study?
Absolutely. And Joe, I'll have you weigh in on the kind of the collection aspect of it. But essentially, it's a collaboration between Brian Heiderscheid up at the University of Wisconsin and his lab, and David Opar at Australian Catholic University and the Sprint lab there, and then Springbok through Sylvia Blemker, kind of the three PIs on that. And essentially what we're doing is or the team is going to take all the money that Johnny thought he was going to get and do the biggest hamstring injury study of its kind ever conducted, and essentially gathering baseline information from a Springbok scan of the full rosters of 4 D1 Power 5 football teams, and then comparing that with some of the functional and movement metrics of IMUs and the like, and then doing that preseason, and then during the season when one of these athletes gets a hamstring injury, going back in and doing some of those same measurements to see kind of what has changed, because I think that the NFL is putting a lot of money into this effort to be able to kind of see if they can identify, or if there is some technology or science out there that can identify kind of who is at risk of a hamstring injury, rather than just relying upon a history of hamstring injury to predict that. And so, Joe has been wearing his academic hat. He's been instrumental in getting that one of the sites set up for us for that. So
yeah, this will be a great project, kind of an intersection between a team of very talented engineers and clinicians, and a collaboration among some very talented healthcare teams, to collect information from as many American football players as we can, that will feed into these algorithms to help predict injuries, help us understand who's at risk for an initial injury and for a re-injury. Definitely excited to be a part of this and to use our technology as a part of that model.
Yeah, like you said, the biggest hamstring study that we know of, definitely has a lot of money and a lot of high profile behind it. I see how you got the grant now. You got the big name hamstring guru researchers out there. But no, I can't wait to see that. And so I think that's what's really cool is, we've discussed this a lot, Scott, is, ways that we can be using this from a predictive, get pre-injury type of measurements on people and see if there's something we need to work on to the other side. Our ACL study, after you tear your ACL, we'll get a Springbok on you so we can see exactly what's going on with all the muscles. Maybe that'll even tell us something if we see a trend of what's happening in these people that are tearing. And then using Springboks at multiple time points, all the way up to a year out, just to see if our interventions are moving that needle. So I think from that injury rehab to potential predictive to potential clear to return to play are just like huge things with this. So obviously we do blood flow restriction, and we think blood flow restriction is key for the muscle and getting muscle back or slowing the loss of muscle. And so, Scott, we kind of met up through Robin West, who's up there in Nova and with the Nationals. And she thought we would be kind of a good fit. And that's kind of how I came on. Do you guys have any thoughts on, our kind of collaboration and partnerships with blood flow restriction and Springbok?
Yeah, absolutely, Johnny. And I think that kind of where it comes down to is that the whole world, understandably, of healthcare is shifting to tapping into objective measurements of whatever it is to really personalize and individualize the care of patients at kind of in any demographic, at any use case or condition or whatever. And so I think that what's, again, kind of most interesting to me about our partnership with ORS is that you're looking at this the same way that we have and are doing. And so I think that you're kind of heavily relying upon technology to be able to inform decisions that clinicians can make, kind of not to replace the human element of it, but really just to make the humans smarter in this space. And so I think that we're always looking to partner with other like-minded organizations that kind of take the same objective approach and move it away from the subjective into that world. So when Robin introduced us and then we talked to Dr. Alderetti and Dr. Sheehan down at CFI and BAMC, we really jumped at the chance to kind of partner with and align our brand with something that's taking the same approach that we are.
Perfect. Well, we talked a lot about the lower extremity. Can we do shoulder, upper extremity at this point with Springbok?
We are headed there as quickly as we can. Actually, we just were awarded a NIH grant to study rotator cuff tears. So we're currently developing models to study muscle volumes in the rotator cuff in patients who have suffered from labral tears to rotator cuff tears to total shoulder arthroplasties. So kind of this continuum of muscle volume and atrophy, as well as fatty infiltration, and how that kind of impacts the surgical decision making, as well as the rehabilitation process and long-term outcomes after procedures that are intended to help restore shoulder joint function. After that, we'll continue to work on the upper body. Our goal is obviously to have every muscle in the body able to be scanned and segmented with our software algorithms, and we're headed that way.
And I would add on the shoulder piece in particular, the two things that are pretty interesting, compelling for that application is that we are set up now to be able to start research projects with that application, so that we have our AI and our machine learning algorithms trained to be able to auto segment that area of the body and those MRIs. And then the other piece that's a big value add or aspect to that is that we can take MRIs that are gathered in the traditional clinical workflow and turn those into those three-dimensional visualizations of muscle volume and fat infiltration. So they're not needing to get a kind of a Springbok scan under our protocols. We can do it from ones that are already being acquired as part of the clinical workflow.
Even an old one? Could you grab an old
Absolutely.
MRI? Nice.
Yep. And that's what we're doing to really train the algorithms. We're getting a lot from the BAMC program and Dr. Sheehan's program down there. We're getting a lot from University of Virginia orthopedics to be able to do a retrospective look at those images, fat infiltration, muscle volume, and then taking a look at some PROs and some of the outcomes that have come from those cases, as well as some of the pre-surgical scoring, like the Gatelier score, and seeing kind of how our objective view measures up with some of the previous scores.
Very cool. Yeah, I forgot Andy was getting you all those retro discs to look at. That's awesome. So where, potentially going in other avenues with this. So, we've been seeing it used in the sports world and with service members, but, you guys started with CP, GC populations that could really be beneficial, sarcopenia, things like that.
Yeah, totally. I think really any, condition where an individual is either, looking for a personalized way to improve their athletic output or performance in any way, to any person who's really suffering from a chronic joint or muscle injury, where they want to really have a kind of again a personalized, individualized care plan based on the most precise data, to kind of give them the best chance of really taking advantage of the most current therapies and kind of avoiding risky procedures like surgeries. I mean, there's so many conditions out there that I think can be addressed with muscle strengthening and rehabilitation and other types of physical training. But it's challenging because the technology to assess muscles is really at current course. When you use functional maneuvers or even strength testing through dynamometry, like through an isokinetic or isometric machine. This technology really gives the most individualized and precise way to identify each muscle impairment, to give a truly impairment-based plan. And one example of that, like I study a lot of patients with knee problems and specifically anterior knee pain. So, which is a problem that seems to really resist most therapies that healthcare providers try to throw at it. And it's kind of upsetting because patients are suffering and they just can't seem to get better. So one example is like some patients with anterior knee pain may suffer from an imbalance from the medial side to the lateral side of their quadriceps. But again, if they know that that's a problem that they're facing, they can identify it and their healthcare team can target it with evidence-based therapies. So low back pain, we talked about shoulder, rotator cuff. We're working with UVA Orthopedics also, and one of their hip surgeons to identify ways to better kind of profile patients with femoral acetabular impingement syndrome and how muscle volumes of the deep hip rotators play into, again, planning and rehab, because there's no way to measure those. I mean,
well, that's some of those we were seeing, when we looked at our Paralympian as well as these other scans. Just seeing those deep hip ones can be very interesting. Well, and anterior knee pain, all you gotta do is get the hip strong.
Right? Yeah, I was gonna say on the West Coast, we treat the hip, Johnny. I don't know if that's the way it is the rest of the US.
Yeah, VFR, baby. Get it on that quad. Okay. And by the way, Kyle, thanks for chiming in finally. You've been asking questions this whole time.
I was just sitting here listening to you guys talk and enjoying the morning.
I got a patient and I want a Springbok scan. What do I do? For one, they can contact you guys, springbok.com, but can you kind of take us through the process?
So springbokanalytics.com is our website. And for sure, check out the website and see all of our prior research and cool pictures. And I think there's a really good picture of Scott up there that shows how good looking he is.
Joe, were you involved in picking the name Springbok?
Actually, yeah. So at the time,
how did you get there?
So a good question. So we were actually when we first formed the company, it was kind of like naming one of our kids. It was like we were having arguments about what to name. It's like there's some permanence in that. So at the time, we had just finished our initial study on the track athletes. So our mindset was in speed and sprinting. So Springbok is a fast animal, fast land animal. Yeah. So we named it Springbok after the little antelope looking thing.
I was telling Johnny when I first heard the name, I have some very good friends that are from South Africa, and the Springbok is the mascot for their rugby team. And every year, like as a special occasion at certain events, they will give Springbok shots. So we'll have to have Springbok shots one of these days.
Right.
And
nice.
It's like some kind of minty thing. So there's a shot.
Absolutely.
It's also a puzzle company too. It's like
really?
I think I've seen puzzle companies.
Interesting.
We were going to name it Hearts Recovery Science, but like that sounded like a stupid name. So
that sounds like you got an ego and it's all about you.
The best part about that whole thing is Johnny's like trigger word is recovery, and it's in the name of his company.
Yeah, we used a company that picked our name. It was a branding company. So they came to me and I was like, seriously, that's it? My last name, Recovery Science. But, all right.
How much do we pay you guys?
Yeah, exactly. Okay, so just getting back to that question on if I'm going to send a patient, do you have to have a special radiologist site or something like that, or how would you go through this?
Well, so I mean, it would entail, at least in these early days, reaching out to us to be able to see where we are working with some imaging partners around the country. So we do have imaging partners in different places. So we can, essentially turn any MRI into a 3D visualization. What I do want to emphasize though is that we're not extrapolating anything. We're staying true to the science. We're not being able to magically turn an MRI of a knee into a bilateral full lower extremity 3D model. It's really kind of whatever has been captured axially, not sagittally or coronally. We can turn those into that 3D model, but it really would be best to just reach out to us and be able to kind of talk through this. And it's really at this point, and probably certainly for the foreseeable future, we're really going to be a B2B solution and not a direct-to-consumer product where we're working with you as the experts and the people who are taking care of the patients, not directly with the patients. We're really Switzerland when it comes to kind of the analysis we're doing and giving you another piece of the jigsaw puzzle to be able to figure out with the individual.
So you want me to modify the show notes, remove your home address where I told people to mail their MRIs to, Scott? Is that what you're?
Yes, absolutely. Please. Yeah, I did just recently tell our website designer to take my cell phone number off of the website. So that was good.
So I shouldn't tweet it out. I'll rescind my tweet just now.
Ah, man.
To all my followers.
Well, fellas, it's badass technology. So glad that we're working with you guys and partnered. And anyone who's kind of still, kind of confused of what it is or what it looks like, definitely go to their website, springbokanalytics.com, not springbok.com, because that'll probably take you to the rugby team. So you can see some of the images of what their tech's like. And I would encourage folks to reach out to you guys. Congrats on this.
Thank you very much.
Any last things you guys want to add or anything?
I guess the only thing I would add, Johnny and Kyle, well, first of all, unbelievably thank you for the time for this. But we actually are really excited about kind of where we can take this with BFR and expand the application not only to the muscle measurements and things like that, but as Johnny and you and I were talking offline about, as we kind of build this out for the measurement of tendons, we'd love to jump into some BFR studies with respect to tendons, whether that's around hamstrings or Achilles or anything that would benefit from that kind of approach. So we really do think that the sky's the limit with kind of pushing the envelope on all these types of analyses.
Sure. Yeah. We definitely want to go there.
I would add, I think that the images that you guys are giving out from just the patient side of things, the ability to kind of physically see what is going on within your limb is a pretty powerful thing for a patient to be able to see. Because too often it's just like us in the room, like, here's a model of the knee, and this is, to actually see, like, this is my muscle. And this is what it looks like on the other side that doesn't hurt or whatever, or this is what it looks like compared to some normative data, someone my age, my height, et cetera. That, I think that's very powerful and will really help with the buy-in side of things for sure. So I think that's really, really unique and really, really cool, and something I'm excited to see get to market a little bit more.
We've seen it, man. You get 100% buy-in. Even these big pro guys, I'm not weak in my quad. Like, dude, look at it on this image. It's pretty cool.
Yeah, so, that's cool.
Awesome. All right. Thanks, fellas. Everyone go check out their website, springbokanalytics.com. And thanks for joining us. If you guys want to learn more about blood flow restriction, go to owensrecoveryscience.com. If you want to get certified, you're not certified, check out our Get Certified. We have courses going all over the world right now. Just finished a big one in Italy and everywhere else. I get to go to like Green Bay and Arkansas, and these guys are all in freaking Barcelona and New York. And anyways, thanks everyone. We'll see you guys next time.
Thanks for listening to the Owens Recovery Science Podcast. Owens Recovery Science is a single source for PTs, OTs, ATCs, DCs, MDs, and other medical professionals seeking certification in personalized blood flow restriction rehabilitation training. Find them online at owensrecoveryscience.com.